glad to be joined now by Dr. Lauren Streicher, and she is the course director for female sexual dysfunction post-cancer treatment. Welcome.
Thank you. Thank you.
You mentioned that one of the objectives is getting everyone to know about the consequences of cancer treatment on sexual health. Kind of give us an overview of what that is.
Well, we know that chemotherapy, radiation, pelvic surgery can all have a profound effect on sexual function, including libido, arousal, the ability to have an orgasm, and then of course a significant effect on vaginal tissue that makes intercourse either very painful or sometimes, quite frankly, impossible. The other problem is that in gynecologic cancers, unlike other cancers, they inevitably involve sexual organs. And in over 90% of cancer diagnoses, a woman requires a hysterectomy, which in and of itself has its own repercussions.
So how many women are we talking about being affected? Do we know?
Well, we're actually talking about a lot of women, because the good news is that over 90% of women with a gynecologic cancer diagnosis are alive 5 years later. So that translates to about 8 million women living with the gynecologic cancer in the United States. However, about 90% of those women have either permanent or sometimes temporary sexual issues that concern them. So there are a lot of women out there who are looking for help.
So is there a difference in the way that you treat sexual dysfunction in a woman who has cancer or who has gone through cancer and somebody who hasn't?
Well, yes and no. A lot of the same things that we offer women who don't have cancer, we're also going to offer to women who have cancer, but there are very specific challenges as a consequence of chemotherapy and radiation. So as an example, a woman who's gone through cancer therapy very often has significant irritation of the vaginal mucosa. And you can't just recommend any vaginal lubricant. You need to recommend a lubricant that is isoosmotic. The hyperosmotic vaginal lubricants will actually cause more damage to vaginal mucosa.
So after your presentation, after the course that you're doing today, what do you hope that your peers here walk away with?
Well, I'm very solution oriented, so I want my peers to walk away with specific solutions to offer their patients. But the most important thing is, too often when the general gynecologist has a patient who's diagnosed with cancer, she's lost, she's gone, she's off to the gynecologic oncologist and they never see her again. Well, the gynecologic oncologist is not going to be addressing these issues. So this is a role that the general gynecologist can continue to take in the care of his patient even after she's had a cancer diagnosis, because these things are important to the woman and no one else is addressing them. So when they finish this talk, they will know exactly what to tell the woman who has concerns after a gynecologic cancer diagnosis.
Anything else you want to tell us about this issue, or why you think it's so important that your peers know this?
You know, I think that it makes a big difference in the life of our patients. And what we know from the literature is that very few gynecologists bring it up. And I think they have this idea that the woman's going to bring it up if she cares. And we also know that that doesn't happen. And quite frankly, there's a real disparity. Because if you look at men that are diagnosed with cancer, for example, prostate cancer, pretty much every part of that cancer diagnosis and treatment discussion is going to include what the impact may be on that man's sexual function. And yet the same does not happen when a woman is diagnosed with a gynecologic cancer. So I want that conversation to happen. And whether it happens with the gynecologic oncologist or it happens with the general gynecologist, it just needs to happen. But it's not enough to have the conversation. We also need to be able to give our patients solutions.
All right, solutions. That's good. Dr. Streicher, thank you so much for sharing your ideas and thoughts with us.
Thank you.